Next up on our speakers list, a strong friend of the Global Forum on MSM and HIV, Chris Beyrer is a professor and director of Johns Hopkins Fogarty AIDS International Training and Research Program, director of Johns Hopkins Center for Public Health and Human Rights, and senior scientific liaison HIV Vaccine Trials Network. He's also the associate director for the Center for Global Health. Chris's research interests include HIV/AIDS, molecular epidemiology, China, Burma, Russia, Thailand, among other countries are his areas of focus. Chris has published extensively in the areas of HIV and AIDS among men who have sex with men, the incarcerated, and drug users, and was the recipient of the Charlotte Silverman Fund Award for Epidemiology and Policy, Department of Epidemiology, Johns Hopkins School of Hygiene and Public Health. It's a great privilege for me to have Chris with us. He's going to share some very exciting results from his research. Chris, thank you for joining us.
Well, thanks very much. Is this on? Yes. Yeah, okay, great. Good morning, everybody. And what I'm going to show you today, as soon as the slides appears. Great. Is some new work that we have been doing with our group at Hopkins, also with some colleagues at the Futures Foundation, and supported by the World Bank's HIV/AIDS program, also with tremendous support from UNAIDS and WHO. And it's really an attempt to look at where we are epidemiologically with these epidemics among MSM, and then to look at combination prevention approaches and to assess the impact of combination prevention approaches. So if that sounds like... Sorry? I feel like Madonna here, except she knows how to... knows how to use these things, and I don't. How's that? Is that better? Okay. So if that sounded like we're going to do some modeling and get into some mathematical approaches, the answer is yes. But don't worry, in the interest of the temperature in here, I've taken out all the calculations and the mathematical numbers. For those of you who are interested, we're happy to share that later.
Sorry, just one more.
I have kind of a big skull, that's the problem. All right. All right, for while it holds. So where are we in 2010? Just quickly, I think we all know that we have, unfortunately, the evidence of multiple epidemics ongoing among MSM in developing countries. We also have a lot of new and emerging epidemics that have just been studied for the first time. And we are seeing, of course, resurgent spread of HIV in high-income countries among MSM. So that is all really bad news. In terms of responses, there's inadequate coverage, and coverage is really going to be the focus of this talk for prevention, treatment, and care. But we also have something of an inadequate toolkit. We really need some more preventive interventions, and hopefully we're going to hear about a couple of those at this conference. On the human rights front, I'll loop back to human rights at the very end, but let me just say, I think, as Michel Sidibé so eloquently said, there have been a number of tremendous advances in rights awareness and community empowerment, like all of you in this audience, in advocacy, but of course we also are in a period, while these HIV epidemics are emerging or being documented for the first time, of tremendous pushback on MSM and LGBT issues and on the human rights effort. So, here's some of the results and information about the global epidemiology. Basically, we reviewed whatever literature is out there now and available on HIV incidence and prevalence in MSM, risks for MSM, coverage of services, barriers to accessing healthcare and prevention services. And we also looked in some detail at the interrelationships between MSM outbreaks and those driven by injection drug use, because in Eastern Europe and Central Asia, there's quite a different picture of HIV that probably is important. We did this through systematically searching the medical literature. It's a classical search that was done by Steph Burrell of our group at Hopkins. We also did an electronic global consultation. I want to thank George Ayala and the Global Forum because we used the MSMGF network to access many of you in the audience, so thank you for sharing your information. And then we did a face-to-face consultation supported by UNDP and the bank in Bangkok this year.